Welcome back. It's now 23 minutes to 8 o'clock. This is Morning Express. On Wednesdays, we like to highlight matters health. And this morning, we're joined by the Chief Administrative Secretary in the Ministry of Health, Dr. Rashid Aman. And thank you for joining us. Good morning, sir.
And pleasure to have me on your program this morning.
All right. Thank you very much, sir. We'll go straight into it. And one of the questions, of course, we had asked earlier on is whether people feel that the economy should be open. But we'll not come to on that for now. Let's start off with your level in terms of satisfaction with how we are doing as a country on our status of COVID-19. Are you happy with how we are doing so far?
Yes, Michael, I think as a nation, we should be proud of what we have been able to achieve. Going back to when this pandemic broke out, it started off as a small cluster epidemic in Wuhan, in China, towards the end of last year. But before long, it had spread far, and it hit our borders in March. At that time, we had already started preparations. We had we had prepared a COVID-19 response plan, costed plan. We had been working with our partners. So in a way, we were ready with what we needed the kind of response we needed to mount. Of course, along the line, we have had challenges, and these challenges have not been unique to us. But I think we have surmounted some of these challenges very well. Challenges in the area of testing, in the area of commodities, in the area of providing, not only the personal protection equipment commodities, which were very critical in the early stages to be able to protect particularly our health workers and frontline workers, but as well the commodities for testing, because testing is really a very critical pillar in the response. And the ability to be able to test and to test quite extensively was important. There were those challenges. I think we have overcome most of those challenges. Today, we are at a point where we see we have maybe perhaps not done, the extent of testing that we wanted, but with over 520,000 tests so far, I think we have done well given the circumstances. Mm-hmm. In terms of our confirmed cases, I think with about 37,000 confirmed cases as of yesterday, we're not bad, and we are seeing the progression of the curve. I think it is something that is pleasing to see that our numbers seem to be coming down. So I think.
Mm-hmm. So generally, you're happy with where we are as the ministry. Now, question is, talk to us a little bit about the testing, because as much as we seem to be seeing the numbers coming down, would like to understand first the method that is being used, and secondly, whether really the numbers are coming down, or are we just testing less and that gives us less figures? Okay.
Let me say that, yes, I think that is an area that needs clarification. When we test, our testing, of course, is to some extent will be limited on occasions by the supplies, the reagents that we require. There has been a global problem with a steady supply of these test reagents. But we have worked out a schedule, particularly with those suppliers that we use their platforms, a regular schedule. So when we are testing, and we have tested on occasions, we have tested over 5,000, sometimes up to 8,000 tests a day, and we come up with large numbers. The key point here is that we cannot just work with the number of positives. The number of positives must be related to the number of tests you conduct. And that way you are able to normalize the figures and be able to compare from day to day. You understand? If you only look at the number of tests, and like yesterday, we tested, I think, just over 1,700 or so. We had 139 cases. On another occasion, we might test 4,000. We have about 300 positives. We must be able to normalize those and compare them. And the normalization factor is what we call the positivity rate. In other words, what is the percent of positives among the samples that you collected? Then you can be able to compare the positivity rate. If you look at the positivity rate, our positivity rate, early on was low. It rose we reached, I think, a point up to 12 to 15% of positivity. But over the past several weeks, that number has been coming down. And we now have reached a point where we are at that threshold, which is dictated by the WHO and the recommendations on determining where we are and what we need to do in terms of relaxing the restrictions that are in place, is really to maintain a very low level of positivity rate, 5% for a period of 2 to 3 weeks.
So are we at
we are in the
Are we at that point where we can say that we can now begin to relax some of the things, or does that need to be maintained for a certain period of time before that decision is made?
Yes, you need to maintain that for at least a steady 2 weeks or 3 weeks, preferably, that you are below that 5% threshold. But in addition to that, you also need to be looking at other indicators alongside. You need to look at your death rates, the hospitalization and all that. Those also should be on a downward trend. Now, we are looking at all of those carefully, and I would not, rush to say that we have reached a point of comfort, but I think the trend is confidence inspiring, and clearly I think it will inform whatever decisions that His Excellency is going to pronounce, I think, when he addresses the nation next week.
All right. And what would you attribute that reduction to? Because when I, from a layman's perspective, look at how Kenyans are behaving, we seem to be forgetting that we're still not out of the woods yet. You tell us that the numbers are coming down. So one is left wondering, how do you account for the reduction?
Well, I think it is only fairly recently that as Kenyans we're beginning to feel, that comfort that we can do away with this. But don't forget that there have been persistent restrictions that have been in place. And we have had persistent messages being sent out in terms of the measures that need to be taken, the personal measures such as hand washing and hygiene, wearing of masks, avoiding public gatherings, and so on. And then there were also the restrictions in terms of, closing of schools, closing of entertainment facilities, transportation restrictions, and all of those. For sure, all those restrictions have contributed to where we are now. If Kenyans begin to relax and not observe those conditions, that's our fear. And that is why we want to be cautious, and we want to continue to send the message to Kenyans that we are not yet, as you said, out of the woods. We need to continue to exercise those measures. We need to take that personal responsibility, because if we do relax that, we are surely going to see an upsurge and spikes, as has happened in other countries. So our message to Kenyans is we need to continue with those personal responsibility measures that we need to take. There are some measures that are imposed by government which will be relaxed, I'm sure, in due time. But there's those personal things that we need to do, maintaining that physical distance, the social distance, our hygiene, personal hygiene of hand washing, avoiding gatherings. I think those are things that lie within us. And we must continue to do that, because those contribute to the trends that we are seeing.
I'd put out a poll yesterday, just asking people what they would like to know from the Ministry of Health. And I got the feeling, and would like you to clarify this, I got the feeling that majority feel it's the Ministry of Health that really advises and says this is time to open or not. But maybe there are several other factors and areas, advisory bodies, that play in before the advisory is given as to whether to relax or not to relax. Maybe just fill us in on that.
I think, that the whole response, the COVID-19 response, has been a one government response. I think that's important for Kenyans to understand. Yes, this is a public health issue, but it's a public health issue or a matter of concern that cuts across almost every aspect of life and every sector in government. And therefore, that one government approach was necessary. If you recall, the president quickly set up in February the National Emergency Response Committee. Thereafter, there has been progression in terms of several layers of coordination that have been put in place, including national security and so on, to be able to coordinate one response to this. So yes, there are many other people who will sit on the table to advise on what decisions to be made. Then on top of that, we also have brought in the researchers who come in with their modeling scenarios. And there are several research institutions, including University of Nairobi, Jomo Kenyatta University of Agriculture and Technology, our KEMRI Research Institute, who all are working together and trying to provide the best types of models that they can, predictive models that they can work with. And all of these together. And that is then where a decision is made. Remember, this is not an easy decision, even for His Excellency, because it is a very delicate balance. On the one hand, you want to save lives. On the other hand, you also need to ensure that their people have their livelihoods, which is their economic activities, their daily ways of, making a living and so on. So that balance has to be very careful. Although health concerns do take, preference over all others, I think it is a delicate balance, and that is how then decisions are made. So health issues do come in right from the beginning. Together, we work through these things and through these committees, and finally, those decisions will be made.
All right. What would you say is the biggest lesson that the Ministry of Health has learned through COVID-19? We certainly have taken home very many lessons, even as individuals, but the Ministry of Health generally, what would you say is the biggest lesson you've learned, and way forward to assure Kenyans that we're looking at a time where we can have, health coverage for everybody, universal health coverage?
I think the biggest lesson, because we have been talking about the Big Four agenda of universal health coverage over the last, 2 or more years. And as a ministry, we have been preparing. We have done a pilot on UHC. We have been pursuing that journey to achieve that. I think the biggest lesson we have learned from COVID-19 is that we must have a working health system. And our health system must be anchored on primary health care and preventive and promotive medicine. Because this pandemic has taught us that. That's what is needed. You need action at the ground. You need action at the community level. You need to engage communities. You need to engage the devolved units in terms of the responses that are mounted, not only for the pandemic, but for any other condition that might appear. So what it has taught us is, and it has actually, I would say, given a great deal of impetus, the COVID-19, impetus to that journey. It's given a turbocharge, I would call it, to our efforts in achieving UHC. Because now, with all the efforts that we have made as a nation, both at the national government and at the county governments, in preparing, in upping our level of preparedness, putting in place facilities that would cater for people who get sick, for establishing those community units and all of that. I think it has given us that impetus now that will continue to build our health system, strengthen our health systems. So the lesson we learn is have a functional and strong health system that is anchored on primary health care, preventive and promotive medicine, which is what we had actually been preaching earlier. But now the truth has come up, and that's, I think, a positive lesson.
All right. And to that Kenyan who possibly would be listening to this or watching this and feels this is just mambo jumbo, all I want to know is, when can I get my health care taken care of? Do we have timelines we're working with?
Yes, there are certainly very, very set timelines. In fact, as you know, the National Health Insurance Fund is undergoing some reforms. And very soon, the National Health Insurance will be able to provide coverage, particularly beginning with our vulnerable groups who have been identified. The households that are vulnerable, that require that cover, will be identified, and cover will be provided to the UHC program. We already are rolling out other elements of the UHC in terms of capacitating counties through beefing up their healthcare worker or human resources in healthcare. by providing the essential commodities to the counties. In fact, the counties have been receiving commodities, health products and technology, that is medicines and other products, through the UHC program, aside from their own budgeting that they have for their health services. They have been receiving that. So all of those things are in play now. And the aim, of course, as you know, the president's legacy was to have achieved a level of UHC by the time, by 2022, when his term expires. And we are working to see that we will attain a certain level by that time.
And we had pilot counties that had been identified, Machakos, I believe there was Nyeri. There was quite a number of counties that had been, 4 of them, that had been identified and used as samples. When do we expect this to be rolled out to the other counties now that that time expired, where the counties were being used as an example?
In fact, Michael, it is actually being rolled out. And the lessons that were learned in those 4 counties have been applied in this rollout. Each of those counties has signed an agreement already with the central government, where certain elements have been agreed upon. These issues that I'm talking about, the human resource support that the central government is providing them, the commodities, and many other things, the community health workers mobilization, have been agreed on, and it is actually happening right now. Some of the lessons we learned, in the pilot counties, the 4 pilot counties, everybody in the county was being given a free UHC card, and services were free. Okay. Now what we have learned is that we probably need to look at this and target initially those that, because we are now working on a larger scale, resources are limited, we will target the vulnerable groups. We estimate those to be around about 30% of our population, and those would then get free cover through the NHIF system, as I've talked about. Others would be encouraged to continue to subscribe to the super cover program of NHIF, but at the same time, we would be providing now the support to the counties in the form of human resources, health technology, health products and technologies, that is the medicines that they require, and capacity building them in terms of training. So it is something that is actually happening. It's just that we have not, it has not been in the front line because everything has been taken over by COVID. But I think as we move on now, you will hear more about this UHC journey we're already on.
As we get to the tail end of this interview, leadership, of course, is where we rise and fall many times. And even in the ministry, would like to just know the kind of leadership that we have. We do know that the CS came in not too long ago, about 6 months ago. And what is his vision and what is his passion and thrust so that we can also hold him to account?
I think we all share the same vision as leadership, top leadership in the ministry. Some of us have been there a little longer. I know that the CS has joined us, as you said, in the last 6 months. But I think we have a shared vision as a ministry and as a nation, and even as following on the one big 4 agenda item that we have to deliver, which is UHC. So in terms of leadership, I think we have strong leadership. Yes, the ministry, we have been, the pandemic, of course, has caused a great deal of disruption, not only within the ministry itself, where we are the focal point dealing with it, but everywhere across the globe, there have been disruptions. I think we have been able to manage that while at the same time continue with the broader objectives of providing affordable quality healthcare to Kenyans. And I think that is one vision that we share, and we are forging ahead with that to try to do the best that we can and deliver to Kenyans, at least by the end of this.
All right. And going back to COVID-19, we've had instances where there was a notion that there could be vaccines. What are your comments on that? Any updates on that?
Yes, you know that there were more than 200 vaccine initiatives in terms of developing vaccines across the globe that are still going on. But a handful of them have moved on ahead much faster. You know very well about the Russian vaccine that is actually being given to patients in Russia, while at the same time undertaking the critical phase 3 trials. There is a vaccine by a group called Moderna in the US that is quite advanced in phase 3, and I think that is one of the vaccines that probably the US government is banking on. Then there is a vaccine from University of Oxford and AstraZeneca called the Chadox vaccine, which is also in phase 3. Now, we as Kenya have had a relationship with Oxford University. They have a collaboration with us at Kemri Wellcome Trust Research Institute in Kilifi, one of our branches there. And very early on, we were part of a small trial, a phase 1 trial of this vaccine that we would conduct here in Kenya. Of course, things went a little fast in some other areas, but that study is now ready and we'll be recruiting approximately 40 individuals or so to test that vaccine. In addition to this research that is going on, there are actually quite active engagements because nations have to now look forward to the availability of a vaccine and what will be the access to that vaccine. There are discussions being spearheaded by groups such as the Global Alliance Vaccine Initiative, where now those nations that will be disadvantaged are given an opportunity that they will actually be able to get certain supplies of these promising candidate vaccines when they come out.
All right.
I'm also told China also has one. The Chinese ambassador was informing us the other day that China has actually one vaccine that is also quite advanced in phase 3. So as a ministry and as a country, we are trying to engage with all of these developers of these vaccines so that when they become available, we would also have a chance to be able to access these vaccines for our population.
To assure Kenyans on the safety of it, there's been all manner of stories going round of what these vaccines could potentially do. How safe are they?
You see, that is why in vaccine development, and for that matter in any drug development, you cannot take shortcuts on the procedures of developing that vaccine. They are very clearly laid out. The clinical trials are laid out. There are several phases of clinical trials. You go from phase 1 up to phase 3, which is very large. All these phases are aimed at establishing two important things. The most critical one is safety of the vaccine. Safety of the vaccine. The second one is the effectiveness of that vaccine. And once you have gone through phase 3, and phase 3 is a large population trial. I mean, these vaccines we're talking about are going to recruit about 30,000 or more people. That's fairly large. But I can tell you, even in that development process, after phase 3, when a product passes through and is safe and effective, it becomes registered, becomes available on the market, and can be used for treatment of patients. But there is something called phase 4. Phase 4 is once a product is licensed and on the market, there is a need now, because the product will be used in a much larger population, there is a need to continue to monitor the effect of this vaccine, because when you expand that population, it is very likely some of those rare events which might happen, which were not picked up in phase 3 with 30,000 or so, will be picked up phase 4. And there are many cases where phase 4 might reveal a reaction, maybe rare, but a serious reaction, which can affect that vaccine's use. So, they are very rigorous procedures, and they must be followed.
So
which is why,
in a nutshell, you're saying they're safe?
If they have gone through the phase 3 trials and have been deemed to be safe, yes, they can be used.
Mheshimiwa, as we wind up, maybe just your closing remarks and possibly your message to Kenyans, particularly, as I mentioned, we seem to be going back to a feeling that, COVID-19 is behind us. What's your message to Kenya?
My message to Kenyans is that this war is not over. This war, if we look at what has happened in other countries who had, their community transmission before us, and some even who had it at the same time, they have seen spikes of some are seeing even the third or fourth spike. Some that were uploaded in their first response where they brought down, flattened the curve, we are still seeing spikes. And that the reason is very simple. The virus is transmitted to human contact, caused by mobility of humans and transmission of that virus. The restrictions that we put in, the advice that we provide is meant to break the cycle of transmission. We cannot relent and relax and allow that cycle of transmission to happen. The hand washing, the physical and social distancing, the wearing of masks, the avoidance of public gatherings and closeness of people, all these elements break the cycle of transmission. And my plea to Kenyans is, please, these are things we can do within our own rights and responsibilities, and things that we must be aware of and exercise. Let us continue to do that, because that is one sure way in which we'll be able to break the cycle of transmission. If we relax on that or relent on that, we will see more transmission, probably a spike. In some cases, the spike would even be higher than what we have seen. And the problem with some of these spikes is they may overwhelm our health systems once people get infected. That we may be overwhelmed and not be able to cope with providing the necessary care, and we may end up with more deaths. So
all right,
we need to be cautious.
Dr. Rashid Aman, Chief Administrative Secretary, Ministry of Health, thank you for joining us this morning just to enlighten us on the status for Kenya on COVID-19. Thank you. Well, that's where we wrap up that particular interview.